Hey guys, thank you so much for being here. I just have a little game to start with. I just want to know, and please raise your hand, if you think the assumption I'm going to tell you is true. So who do you think, I'm trying to understand which disease have been treated or not. Who thinks in the room that common cold, the cold you have during the winter time at Christmas, has a curative option and can be treated? There's no option. You have a cold for 1 month, you can just symptomatically change it, but there is no cure. Who thinks that psychedelics are 100% safe? Not really. There's more than 1% of stroke, mini stroke. Your vessels can be affected. Next one. Who do you think that is a treatment for low libido? And when I look at all of you, I think like there's maybe a room solution for that. There's no treatment for low libido, right? Nothing at all. So this just means that biology is too complicated for the human mind, and we are not getting very, very far ahead on very simple conditions, such as common cold or libido things. So it's really true. What else is very important is cancer. And I'm an oncologist by training. My name is Clozel. I was trained in the US and France. I created Okin, which is the first unicorn in the space. We backed by Google. And we tried to understand biology with AI and create a new type of intelligence. What about cancer now? We talk about common cold, libido, which matters, and cancer. Well, you know what's happening with cancer? We are seeing younger and younger patients every day having cancer. Pancreatic cancer at 40 years old did not exist 10 years ago. Now we see a lot of them. Brain tumors, glioblastoma, same. You all know people around you that suffer from some type of brain tumors. And you know it's linked to a lot of like hormonotherapy. So what the hell? Is this aging? Is aging the cause of cancer? Can we just go there? No. Aging is the cause of many, many diseases, including cancer, but it's not the only cause. Maybe every virus gives a cancer. When you don't have shots and you have HPV, you can have cervical cancer. When you have a hepatitis in your liver, you can have a liver cancer. Maybe we have all viruses are creating this cancer. And you know what? We only know 4% of viruses in the world. We know better the space than the viruses. So how are we going to solve that? It's just too complicated for the human mind. We need a new type of intelligence. There is no way the human mind is going to cope with biology. People are still doing biology with a few arrows here and there. It's a computer somehow. But there is too many scales, many organs. There are too many modalities, images, genetics, language. A lot of people are using language, but language is a very small part of your brain. It doesn't really matter so much for biology. So there needs to be a new way to think about this. And it cannot be a human intelligence. It has to be an artificial intelligence to be able to cope with the complexity of biology. So the paradigm of this biological artificial superintelligence, I just want to remind you what means ASI. So what we call artificial general intelligence. Has any one of you heard the word AGI? I think it's like what's trying to achieve OpenAI or Anthropic. By the way, they start to work a lot on biology. It means you have the same level of humans. You go to the same level. In biology, the level of human intelligence is lower. So you can go above, and what we call ASI. So it's a new way of thinking it, what we call biology, artificial super intelligence, BASI. So what does it mean? It means first we can understand the cause. We can really understand what causes cancer. Maybe aging is a very, very big risk factor. Probably the cause, because when you age, you have more chances of getting cancer. But why? People at 40 years old get a pancreatic cancer. You're going to tell me the water, for sure. The water is not very good. And very difficult problem, the water, nitrates, whatever, the microplastics. You know, we all have microplastics in our brain, more than we think. So there's a lot of reasons, but we don't know why. Can we go to causality? Can we understand the cause of diseases? It's pretty much the most important thing to do. And I just want to explain you how to think about causality, because this is the holy grail of biology, AI in general. There was a study made in France about cars, and they look at colors of cars that were having more accidents. It turns out that cars that were completely red had more accidents. So why so? Because people that buy red cars are a bit of like, whoa, yeah, whatever? Or is it the cause? How do you know? The only way to know is you create a perturbation. You're going to paint car in a different color, in blue. Guess what? They had the same number of accidents. So you create a perturbation, you change the system, and you finally end up that it doesn't change. This is how you get to causality. Causality means you need to create a lot of experiments where you create perturbation. You give treatments, you change the room temperature, and this is the beautiful aspect of pharma for AI. Pharmaceutical companies do treatments and create perturbation data. So a new type of intelligence will understand the causality of everything. Then it will be able to cross across domain. An AI that can go from understanding mental health to cancer, will go to immunity, because in the way, everything is linked. You know that when you have a lung cancer, having a really good teeth state change your outcome. Everything is linked. There's only one body. Having a good heart is absolutely essential for everything else, because we do die of no more coronary function. So this is really, really important. And then we need to be able to implement this in the real life. This is really what the steps that we want to go to this web biology artificial superintelligence. At Okin, with my team, our head of research is the head of Google Brain, and we have many, many people from DeepMind, more than 300 people researched in the research team in Paris. We were able to create this one software. Only one software. It looks like ChatGPT, natural language, you can chat with him, but it's really about finding new ideas, finding new hypotheses, new experiments, and being able to even build the molecules at scale, meaning we can do 100 experiments every month. We can potentially discover 100 molecules every month. If we do the pharma way, one here, I'm going there, I don't have the right antibody, and this is the problems, right? You need to be able to parallelize things. And this is maybe the biggest problem of big pharma, not being able to parallelize experiments. We need to try 100 things at the same time with a new type of intelligence. So how does it work? It's a bit technical slide. What do you need to build a software like our software Okin K-Pro? You need to be able to have first what we call LLM, large language models. Large language models, you have a few around, right? You have GPT-4.5, you have Fable, the new model from Anthropic that is too dangerous to be used. It was a very powerful model, but also very powerful marketing. But LLM is large language model. It's just how to be able to reason a biology. We call this reasoning models. Today, if you use GPT-5 or you use like Anthropic, they're not really trained on real patients. They're trained on the World Wide Web. So it doesn't really work with real biology. It has a really good sense, but if you have 5 times the same questions, you have 5 times the same answers. So we are using Claude, but we also use our own LLMs that we train on real patient data. Then we need what we train skills. Skills, you may have, people that are using Claude may have heard of skills. Skills, it means you actually download people's minds into a piece of prompt. We go to the best doctors in the world, and we're going to ask them. We go to David Sinclair, or we haven't talked to David Sinclair, but others that are extremely amazing mind, and we will say, how do you think about biology? What is your art? The best doctors, how do you treat these patients? Today, in medicine, you have engineering. Engineering means you just apply what's being published. You have what we call science. You create new clinical trials. But the most beautiful thing is art. Why some people can treat a patient in the forest without anything else. We need to capture this into pieces of code. And if you have skills, which means the mindset of people, how they think into piece of prompt, you have less variability in your large language model. So you can use LLM, but you don't have a different answers every time, right? Which happens with Claude today or Gemini. And then we bring a lot of tools, data, and way to analyze the biology. How can you describe a biopsy with AI? How can you build a new molecule, an antibody with AI? Can you run a clinical trial experiment? We have to do the full life cycle of the drug. Guess what? The pharma agreeing on this. I was with the CEO of a big pharma called Takeda, Christophe Weber. He told me, I think R&D is over. The pharma has discovered the space of molecules we could discover. But we are failing. We are failing on pretty much everything. We're failing on cancer. We're failing on Alzheimer. It doesn't really work out. So we need to give research and development to AI companies. And pharma will keep the late stage. So the biggest, most important piece on all of this story is data. But data cannot be the World Wide Web. It has to be really super high-quality data. And when do you have the most high-quality data? In the best hospitals, like Karolinska. Pretty amazing, right? You guys have the most amazing hospital for breast cancer, probably in the world. So what we do is we install our own infrastructure, own server in every of the largest hospital, so we can have data at scale all the time. And then we go and we curate data, we put our software, and then we can capture data. And today we have the biggest one in the world, from Sloan Kettering to Cleveland Clinic to Gustave Roussy, NHS, Pittsburgh. We work with all of the largest ones because the quality of data matter. And guess what? It needs to come from everywhere. Because if you train your model with MD Anderson in the US, it's not going to work in Karolinska. It's not going to work in Paris. It's not going to go anywhere else because people are treated differently in every hospital. And patients have different backgrounds. So you need to be able to train your model every time. And when you look for a company in AI in biology, always wonder, What are the data coming from? Is this real people? Is it not the World Wide Web? And why is it who is the doctor who was treating these patients? Because it really matters, right? If you have surgery data for pancreatic cancer, the time of surgery matters. So we have really the largest, I think, data network in the world with 1.2 million patients that are at the single cell level. And this is how we train our AI, how we train our foundation models, and how we train the AI scientists. Finally, it's very much what I said before. We do all the life cycle of the drug. Finding new biology, new targets is key. We have competitors, isomorphic labs. There's back by Google as well. It's like really focusing on chemistry to replace pharma. We're focusing on biology. We think biology is the key thing. So today, what we try to discover first is the why, the causal biology. Can we finally understand why people have cancer? As an oncologist, it's so frustrating. You have people that are so young and come with this cancer, and you're like, why is he here? Why is she here? There's no reason. I don't want these people here. And then they relapse. You have no idea why. I can tell you, I had people that were like super healthy, doing so much sports, eating vegetables, fasting. They're still at 35 in our department with the cancer. It doesn't so much matter. We don't know much about these things. And cancer especially is so multifactorial that we have to discover more. Finally, the best time of this, the best companies, and I think we are doing this, have to be completely loaded in the full circle of health. You have to be connected to care. You have to make a new treatment, finding the targets, but also the biomarkers. And then you have to run to build the molecules, test it in real life in clinical trials, and go back to see if it works in the patients. You cannot be just a software 100% disconnected from care. Care and research have together. It's the same patient in the pharma or in the hospitals. And this is really what we have to think about, is how can we use the same tools towards everything in health, because treating a patient at a stage 4 cancer is linked to new biology as much as finding a new therapy. So we have a wet lab, of course. It's becoming automatized and robotized. Why is a wet lab super unique? Because in AI for biology, it's another key term, a hashtag, because all of you probably have Instagram. I don't, but you'll teach me later. One of the most important hashtags is a lab in the loop. It means you have a lab that is connected to the agent, and you can run experiments all the time to check if what you discovered is true. It even become a bottleneck, because you have so many discoveries with the AI scientist. The AI scientist is like a virtual MD PhD, working 24/7, finding ideas all the time. It's being validated internally by other agents, but it also has to be validated. So labs are validating everything, but they're also creating new type of data. And I know the type of data that are needed, because you know too, it's called perturbation data. Once again, causality is more a data problem. You want to be able to take cellular models and create perturbations, so you can infer causality. Just an example of sarcopenia. I took sarcopenia as one example, how you run our program on this. Sarcopenia, you know, is like losing muscle. You know that everybody's losing 1% of muscle after 50 years old, right? The only way to gain muscle is to do it before. Why muscle matters? Because muscle is to be strong, to not fall, which is the first cause of mortality, but also for metabolism. It's where the glucose is being metabolized. So having good muscles, it's better control of your glucose, better metabolism. People forget about this, so it really matters. Unfortunately, everybody loses 1% of muscle. I'm French, we lose even more because we never exercise. We hate it. Doesn't work. I have a friend that promised he would never exercise in his life, ever. And you know, maybe he's right? Look at the blue zone in Japan. Are they super athletes that do a lot of things? No, just active, right? So maybe sport is not that good. We don't know. I'm kidding. I think really the only longevity thing is exercising, right? So we wanted to understand sarcopenia. A big thing about sarcopenia is when you take GLP-1, you lose more muscle at full dose. A lot of people are taking low-dose GLP-1, right? So if you lose a lot of muscle, you also lose of weight, you do lose muscle. So how do you build that back? All the pharma that have missed the GLP-1 phase are trying to go to a treatment for that. And there's been amazing, like Matthew has shown, amazing work he's doing which is totally striking. For us, the idea was, I'm putting on my button and in my software, give me 4 new ideas. I want new ideas, things that have been undiscovered. And Aubrey de Grey, we'll talk about this later, is like being able to build in unexplored space. So this is just, we press on the button, I'm going to show you afterwards, it tells me 4 ideas. It's like 4 agents, 4 lateral virtual MD PhD working on parallel. And this is the 4 launches, the 4 ideas that have been taken. So you say, okay, I'm interested, run it, go on the compute, run these ideas, and it looks like that. So it runs about like trying to say, what is the protocol of research I want to do? This is the protocol of research, so it's just a demo. I want to understand GLP-1 induced sarcopenia, and I want 4 ideas, 4 agents working on it. You can put 10, right? If it's in May, we're in France, we don't work so much, we put 4. It depends. So then we go to launch the campaign. Launch the campaign is going to take 2 to 3 hours. 2 to 3 hours having some research in the cloud, using the workflow of research, using LLM, tools, skills, data from all over the world. And then you run it, and it's going to discover new things. This is all the discoveries that we're going to be made, and I'll show you after because it's a bit too fast, I don't have so much time. It just gives you the results, what we have discovered, the deliverable. Every deliverable is in the file. You can open the file, look at the results. You have all the results one by one, so you can write your paper right away. And we are publishing a paper in Nature Medicine very soon based on just this technology. And then you have all your results one by one. You understand how the computer has worked. It's called chain of thought, because data scientist wants to get it. And then it just give you all the results. You can see here, it's a bit too fast, sorry. But you can see one by one, all the results have been taken on the thing. Then what happens? We have a board of agents that we built that's going to try to figure out if this makes sense or not, and showing what is the best 3 results. And here were the best 3 results in 2 hours that I go with my automatic campaign, with my 4 agents. We have a leaderboard. We see, is this novel? Is this druggable? Is this a good idea? Does it make sense biologically? We don't only stop here. We draft everything. We also run, and we don't have the details here, the experiments have to come next. What is the next experiment? So that's pretty much the idea of having a new type of AI scientist, automatizing research, and finally trying to understand biology to treat patients at scale. Thank you. Yeah.